All right, welcome back to Pharmacist on Call. Your host, Dr. Shawn Pruitt, yours truly, your community pharmacist. All right, looks like we're going to get back into the calls. We've got Lamont on line 4. Lamont, welcome to Pharmacist on Call. How may we help you?
Hey, I take medicine for high blood pressure. One of them is amlodipine, and the other one, I can't think of the name of it right now because I don't have them in front of me. But one is don't skip a dose, and I want to know what's the symptoms or what's the drawbacks of skipping the dose.
Skipping a dose. Well, the first thing that I always tell all my patients is to take your medication as prescribed, and that's for a reason, because you have kept your blood pressure at a certain level. You miss a dose, and your blood pressure spikes. So that is the drawback to skipping a dose. So you don't need to do that. That's what keeps you at a steady state. That's what keeps you from having a heart attack or a stroke. So make sure that you stay on your medication.
Okay. For instance, like I'm visiting out of town, but I walked off and I forgot my medicine. I've been here for 2 days, and I have not been able to take my medicine like I'm supposed to.
What milligram do you take?
One of them is 25.
That hydrochlorothiazide?
0.5.
Okay. You say amlodipine is at 5 or 10 milligrams?
Amlodipine, I think, is 12.5.
Okay. It sounds like carvedilol. So you're saying you're here in Nashville visiting out of town, and you left your medicine behind?
Actually, I'm not visiting out of town, but I'm at my daughter's house, and I've been here for 2 days. And
Okay.
what I didn't do was bring my medicine with me.
Okay, but you're able to get it?
Yes, I can get it.
Okay. Yeah. So I wouldn't miss, certainly not 2 days of your medication, especially if you've been regular on it and it's controlled you. Yeah, very important, especially with blood pressure. They call it the silent killer.
I know it, and that's what everybody's been telling me, and I don't want to not wake up, but the thing is, I just want to know if it was a great big problem about me not being able to take it.
Okay, I'll say this.
2 days.
Let's not find out if it's a great big problem. So do what you can to get to it.
Oh, it is a great big problem?
Let's not find out if it is.
Well, I understand that. I just want to know that if I miss 2 days for whatever reason.
Yeah. I think you'll be okay, but so don't work yourself up.
Okay, because I've been taking it regularly, and I didn't want to miss 2 days and think that I was going to have this great big problem, because I haven't seen any symptoms except for like this morning I woke up and there was a ringing in my ear.
Okay, that's tinnitus. I'm not sure if that's related to it. Usually it would manifest as a headache or you start to feel weak.
I have none of those. I haven't had any of those.
Okay, but it sounds like your blood pressure is pretty well under control on your medication. So I think you're okay, but get to it as soon as possible.
Okay.
Yes, sir.
I appreciate that, man. I really do.
Yes, sir. No problem.
So I really need to know that everything's going to be okay.
Yes, sir.
Thank you, man.
No, thank you for your call. Alrighty. All right, we're moving on to line 5. We've got Bob. Bob, welcome to Pharmacist on Call. How may we help you?
Hey, how you doing?
Pretty good. You?
Wondering, is there any natural or either any pills that I could take for penis enlargement?
For what, sir?
Any natural or any pills that can be taken for penis enlargement?
I believe that there are some supplements. I'm not sure about their validity. I believe the way they work is just like any of your other medications. What they do is they sustain the erection, so naturally it's going to, look bigger. But they can make, those outlandish claims. But I'm thinking those will be multi-trillion-dollar companies overnight if that were actually true. So, to my knowledge, no, sir.
So it's nothing that actually works?
No, sir. Not to my knowledge.
Okay, all right.
But if you find something out there, please call in again. I'm sure the viewers would be interested in that.
Okay, I appreciate it.
All right, thank you.
Okay.
All right, thank you, sir. Looks like we've got on line 6, John. John, welcome to Pharmacist on Call. How may we help you?
Hello, doctor. Appreciate your call.
Thank you.
I was just wondering, they say I have a hereditary condition, and my first cousin, she's also got it. I have to go to the doctor at least 5 times a week to have earwax taken out of my ear. I mean, and I know it sounds sort of gross, but anyway, do they make an over-the-counter saline or anything that I can do to help reduce that? I mean, sometimes it just gets so painful, and I was just wondering what your thoughts were, and I'll hang up with them. Thanks.
Oh, well, actually, sir, let me ask you this. What have you tried?
I'm sorry?
What have you tried for the earwax?
Well, what I do is when it starts hurting, I go and get it. They clean it out, however they spray stuff in it and try to clean it out. But they say it's hereditary. My ears are clean. It's set down in there around the,
Whether you station 2, deep into. Yeah. Now, there's a product called Debrox, which helps break up the earwax, Debrox, probably in a green and yellow box, I believe. Cerumenex is, I believe, the active ingredient. Try that. And then I have another patient, Lisa, if you're watching, thank you. She uses earwax candles that she's been begging me to get in forever. There are candles that you burn that specifically deal with that earwax. Give me a call at the store and I can find out what specifically those candles are, and I believe they'll help you. 2 of my patients use those.
All right, thanks, Doc.
All right, thank you. All right, line 1, we've got Judith. Judith, welcome to Pharmacist on Call. How may we help you?
I heard you a while ago describe to a lady that had a sleeping problem.
Yes, ma'am.
Excuse me. And I have the same thing. I don't go to sleep. It's like I can't turn my brain off when I first go to sleep. I can't relax. And I've had this a long time, and I've been doctoring it with my regular doctor and all. But you said something that you take that relaxes you, and I didn't catch it. I was listening, but I didn't catch the name of it, and I'd like to try it because the prescription drugs, the ones that will work, make me feel so bad the next day.
Yes, ma'am.
And I'd just like to have something that will relax me enough, because after I go to sleep, I'm fine. It's just that I can't get off to sleep.
Okay.
So what was that? Gamma something, wasn't it?
Two products. Forgot to mention the other one, but yes, ma'am. The first one is GABA, and I'll hang up here and let you listen in.
Hey, yes, let me hang up so I can get it.
Yes, ma'am. All right, the first product is GABA. It's GABA, and it comes in a 750 milligram or 1,000 milligram tablet, gamma aminobutyric acid, and depending on the type of the quality of sleep I want to get, it depends on how many tablets I take. So 1 or 2, just if I want to get a decent night's sleep. If it's the weekend and I really want to snooze long and hard, then I'll take about 3 or 4 tablets. You can go pretty high on this supplement. I'm sorry, I won't call it a medication. And then the other one is Kava, which is actually an anxiolytic, kind of like GABA is, but it is pretty effective also. So the primary cause, I would think, is that you've got something on your mind, which is what I would suspect with you, ma'am, that, you said you're probably focused on a number of things, maybe not necessarily bad things, but just how much you've got to do. Which is my case as a business owner and several other business owners that I speak to. So that is why GABA is important, because it just helps me relax without even thinking about any of that. Even if I happen to get up in the middle of the night to use the restroom and I try to think about whatever's bothering me, it will clear my mind and I'll go right back to sleep. So GABA, my first choice. Second choice, Kava. All right, looks like we're gonna go to line 2. Welcome to Pharmacist on Call. How may we help you? Oh, Barbara?
Yes.
Welcome to Pharmacist on Call. How may we help you?
Hi, I have a question. I'm allergic to steroids,
Yes,
and I
ma'am.
would like to know if Flonase nasal spray, which is a steroid, gets into the bloodstream.
Okay. First question, what happens when you take steroids?
My hands swell up and get red in my feet. It has to do with the nerve endings.
Okay. All right. Chances are yes, because when you deal with the mucosa of the nasal passages, yes, ma'am, it's going to get into the bloodstream. So the nasal passages and the mucosa right under the tongue, probably the quickest ways to get something into the bloodstream. So yes, ma'am, they will. And yes, yours is a true drug allergy. Many times patients will say what is a side effect and call it an allergy. So yours appears to be a true allergy.
All right, thank you. I appreciate it.
Yes, ma'am. Thank you. All right, you all hang on. It looks like we're up on another break. The phones are lighting up, so call in with your questions and your concerns. This show is about you.